Hi, my name is Curtis Walker, and welcome to CourageousCaregiver.org. Today we're going to be covering Dementia Communication Skills 101. Now, when it comes to talking to someone with dementia, you're dealing in a world of total chaos and total confusion. So, to engage somebody who has this disease and going through memory impairment and them, first of all, losing their identity, and then their brain is trying to rewire itself and survive as best as can, but you as a caregiver are also having to engage with them, it becomes very frustrating. So I wanted to share with you some basic things. There's a lot really that's designed to help you communicate better with a person with dementia, but I want to hit on some of the top 4 things. Thing number 1, people with dementia, they're going to function a certain way that may seem completely odd, weird, and strange to you. So the first thing that you need to do is assess the harm. Look at the activity that you're doing and ask yourself, is it going to cause physical harm, danger to themselves or anybody else? And if it's not going to cause harm to anyone, then the thing that you need to do as a caregiver is you have to take a step back, take a breather, and ask yourself, is it really worth engaging my loved one on this issue? Because I must warn you, when you choose to engage, be prepared for them to fight back. They're trying to fight back for their identity of who they are. So as you engage them on something that's minor, or more so I'm telling you, pick your battles. Some battles are not worth getting into. Now, once you get past the initial assessment, then you actually have to look at the situation from the point of view of, well, how do you address the disease? I know that as I cared for my sister, she hated the fact that we called it a disease. She hated the fact that we constantly treated her like she was sick. Now, yes, it's a diagnosed disease, but you as a caregiver have to be smart. You have to pick your battles, but you have to pick how you're going to jump into the battle. You can treat it like a disease without treating it like a disease. You don't have to call it a disease. You don't have to say it's dementia. You don't have to say that the doctor says that you have a problem. Try to treat them as normal as possible. Try to treat them as someone that you love. Try to treat them with respect. But be deliberate and try to say, or try not to say, you have a disease. Now, the next thing that you want to really work on is, I've seen this happen in a lot of caregivers. You have a person with memory impairment, which means that things that they consider factual, they're going to get wrong. They're not going to remember names, dates, places. Portions of that is going to be stripped away from them. But we as caregivers, sometimes I've seen some have that strong tendency to want things to be right and they want things to be correct. So they get themselves in a habit of constantly correcting their loved ones. So what? What's the big deal? If they're wrong, it doesn't harm anything for them to be wrong. Give them room to do it. Unless they're answering a question that's in an official capacity, like let's say they're in a courtroom and they're swearing an oath or something like that, there should be no reason for you to have to correct them or for them to have to be right. Because the warning that I'm trying to put out to you is that if you're going to engage in constant correction, you're also going to have a person who is going to fight to be right. The more fighting that they have to do also equals the more stress that they have to go through. The more stress that they have to go through also means it's going to accelerate the effects of the disease. So if you want to improve the quality of your life, their life, and the relationship, step away from trying to correct. Then the last thing that I want to share with you is go into their reality. When a person has dementia or Alzheimer, they have to develop a new sense of reality in order to cope with day-to-day living. And the reality that they might be living might be different than how they were before the disease set on. You have to give them room and flexibility to work within that reality. Some of their realities might be extreme. I know that my sister sometimes would engage me in conversations about our mother, who passed away several years before. And she would say things like, you know, I want to go see mom. And I had to learn that I couldn't tell her that, you know, that mom is gone. Because the moment that I mentioned it to her, it caused her to actually relive the pain of initially losing mom. So I had to get smart and wise a little bit about that. Instead of talking about saying that, you know, we can't go see mom is gone, I would say, yeah, mom was pretty cool. I remember, you know, when she used to cook her famous turkey and dressing. That stuff was wonderful. It was phenomenal. And we get in a conversation, my sister and I, and she would engage in that conversation. And then it would shift from food to talking about things that my mother would do, as far as like she was a sewer. So then we get on the subject of sewing. And the next thing you know, as the conversation would change and transition, we're no longer talking about her wanting to see our mother who's gone, but we're talking about, you know, how great my mom used to make fancy fine dresses, and now she's thinking about, you know, where's her purple dress that she likes to wear or something like that. So, you know, I'm just throwing that purple out as an example. But either way, I just wanted to make sure that as you engage with them in their reality, you let them have their reality. There's nothing wrong with it. It's no harm in it. And actually, it's okay to have a little fantasy. We watch TV all the time to try to escape. So the person with dementia, let them have their moment. So hopefully this video helped you a little bit with the tips that I just gave you. Try them, use them, and really improve the relationship and quality that you get to have with your loved one. And just cherish those moments and love on them with the best time and love and energy that you have. I want to thank you for checking out these videos. Stay tuned for other videos to come, and just have yourself a blessed day and a blessed time with your loved one. Take care.